Hi, I'm Matthew. I've suffered from mental health problems since the age of about 13, mainly manifesting themselves in anxiety, panic attacks, and depression. I think it's really good that the EDP are doing this campaign to highlight mental health issues, particularly with men who may be less likely to talk about how they've been feeling and less likely to go to the GP, for example, about their health, their mental health. I think it's really important that as a society we lift the veil really on mental health problems and make sure that people feel a bit more comfortable about talking about mental health because the sooner they can get the right support, the sooner that they can start feeling a bit better, and that's the most important thing. Shockingly, the leading cause of death in young men is suicide. We don't talk about it enough. We kind of think it's a bit of a taboo subject, but we need to talk about it more, and we need to be open and honest with people. You know, it's not their fault. It's not a weakness if they're struggling with their mental health. It's something that can really affect people's lives and change people's lives badly. So the more we talk about it, the more open we are, the better it can be. I help run a small self-help group for people with mental health issues called the Way Out Society. We meet every 2 weeks in Norwich for a few hours. People can talk about how they've been feeling, they can listen to other people's experiences, and hopefully get some tips and techniques about how to help their conditions. And I think one of the most important things it does is take away the isolation that many people feel suffering from a mental health issue. It's kind of an invisible illness in a way. You could walk down the street and you could feel as though you're the only person going along who feels really bad that day. Now, you know, rationally we know that's not the case, but when you're thinking negatively in an irrational way, which goes along with mental health, it can feel that way and you can feel very isolated. So it's incredibly important that the EDP are doing this campaign, and I hope it goes well, and I hope that we can encourage more people to talk about mental health, and if that can lead a few people to go to their GP and start getting some treatment and help for their problems, then that'll be fantastic. You know, that's what we need to do. And as a society, I think we need to prioritise mental health more in the NHS. You know, we know, for example, with cancer, that the earlier you detect the disease, the better it is, the better outcomes it is for patients. And it's exactly the same with mental health problems. The sooner that you can detect the problem and get it treated, the better it will be. But however long you've had a mental health problem, it can get better. The tunnel may seem very long and windy. There may be routes off in different directions which turn out to be dead ends, but eventually there is a light at the end of the tunnel. And if you can get support and help along the way from your friends, family, and from the GP, etc., then that's all good, and things can improve for you. So the campaign is really, really important, and we should all be getting behind it. Thank you.